Today is a special day or a big milestone in the history of Canon Hospice of community service that we have been doing. And we've done this home vaccination or sort of Carla Brown, COVID Crusaders, and Canon Hospice knocking on the doors and then trying to get their vaccinations. And this has gone very well. Carla is going to maybe enlighten on the numbers and then maybe a little bit more details, but we have reached perhaps a peak. And this was actually meant for Black and indigent or impoverished neighborhoods. And we have possibly reached a peak. And now we have a large group of potential individuals that could be vaccinated, and that is the children and the teens. And as you know that Pfizer and Moderna has been approved for anybody over 12 and above. And we are hoping very soon, maybe in a few weeks, that we would have that age criteria go down further. And so it will be a fantastic idea now that we have Tulane volunteers, that they actually could approach this school board or schools to talk about importance of vaccination. As some of you guys know, the Tulane insists on vaccination for in-person classes. There are a lot of colleges that are doing the same, and but it is not mandated that you have to receive a vaccination. So there are a lot of people that are still resorting to not getting vaccinated and then being on virtual classes and that sort of thing. So this is a great opportunity as we finish or maybe finishing this closed chapter of knocking on the doors and completing the vaccination, that we have younger individuals. And actually, as a matter of fact, I was talking to a pediatrician yesterday in his office that he had about 6 patients that he gave vaccination. And so there is a potential for teens, and that's something that I think we need to talk more and then do it. And as you know, Delta variant is a big concern. Scott Gottlieb is the former FDA chief, fears that this is going to be a problem. And this has already surfaced in pockets, Kalamazoo in Michigan, Missouri City. I've already got a lot of hospitalization, and I really wanted to impress upon you with this number from LA County data, where as you see that there is a clear distinction between the vaccinated people and unvaccinated. They tracked for 6 months. As you see over here, the people that have gotten sick, almost close to 500,000, are all those that are unvaccinated, as against the vaccinated, which is 1,891, which is 0.4% of the total population of those who got sick. Then you see the hospitalization, 12,707 hospitalization, which is a significant medical cost to the whole United States system, healthcare system. And 98% of them are hospitalized because or they are not being vaccinated. And as against hospitalizations that are very minimal, it's like 1.3%. And the deaths, as you see, the deaths is 99.8%, which is out of the 12,707, 12,215 people died. All of them were unvaccinated. These deaths could have been prevented or reduced. So this is the message that I want you, this is the statistic that I want you to talk about it in the community, how valuable and important it is for the society, as it is, and the country as a nation, that we really need to be healthier and COVID-19 free. And this is our opportunity. And what I'm really concerned is about the Delta. As you see in California, they tracked within 1 month, the spread of Delta has tripled from 5% to 14%. And the concern is actually more important on the vaccinated people. In UK, they found some vaccinated people that have got Delta variant, although it's a small number, but that is of a concern. So this is very, very important for those who are vaccinated to go out and talk about the importance of vaccination to those that haven't received yet, because they may be doing a favor to themselves. The key is to vaccinate as soon as possible and as many people as we can, because we're almost closing to 3 billion people that are vaccinated throughout the world, but it needs to speed up because we are about 8 to 10 billion people around the world. And a lot of them are still getting sick and a lot of people are still dying. So it is very important, especially the Delta is on upon us and here in the United States. And let us see exactly, what is the problem with those people who have received Pfizer and Moderna and or other vaccines that may have still got sick. Here is the distinction between the vaccination and their yields. As you see, the lowest one is the CoronaVac, which is Chinese made vaccine, which is 50%. You might ask as to why somebody would want to take it. Unfortunately, there are no countries that are receiving the vaccine, so they have no other choice. And as a matter of fact, World Health Organization, all it requires is a 50% yield for a vaccine to be approved. So that's how it got approved. And we are seeing a lot of countries that may have been vaccinated with these vaccines of low yield that are showing a lot of COVID-19 patients, and some of them may be Delta variants. And as you see in a Pfizer and Moderna, Pfizer tops the list with 95% yield. So the people that are in the United States, that we only have Pfizer, Moderna, and Johnson & Johnson that have been given, they are concerned about the Johnson & Johnson, although it is one and done, but they are saying that they may need a booster to prevent, especially with the Delta variant, in our doorstep. And a lot of people, there is still research that's going on where the booster could be with a Pfizer vaccine or a dose of Moderna vaccine. So so that's very important to understand exactly the yield. I'm not suggesting that don't take the Johnson & Johnson. There are a lot of travelers that really don't have a time, and in fact, as a matter of fact, there is a Ninth Ward Crescent Care clinic where they vaccinate with Johnson & Johnson in addition to Moderna and Pfizer. They went on the ship. New Orleans receives a lot of ships from different countries, and they were so excited. There's a ship from India where they actually fed them a nice Indian meal, and for a Johnson & Johnson, a shot. So this is very important. So it is very helpful because it's a one and a done vaccine, and although the yield is very low. And the main reason why the Delta variant is really getting us back to the mask mandates again, and perhaps social distancing. World Health Organization urges fully vaccinated people to continue to wear masks as Delta COVID variant spreads. And in terms of the travel, summer is coming and a lot of people wants to travel. Well, you want to go to Portuguese nation, that you got to be vaccinated. And especially if you're traveling to United Kingdom and going to Portugal, mind you that they are going to require 2 weeks of quarantine. So you got to be prepared to have extra days and extra time and extra money as well. Paris, if you want to visit Paris, Eiffel Towers, you got to be vaccinated. Unvaccinated people are not allowed. How about Italy, Rome? You want to go over there? Yes, you got to be vaccinated. And on top of that, you got to have a negative COVID test before you enter the city. Spain, you got to be vaccinated. No ifs and buts. They're also concerned about the people that are traveling from United Kingdom into Spain, into Greece. Spain, Spain is another country, very worried about the Delta. And they're also having some restrictions on people coming from United Kingdom. But if you're traveling there from United States, you got to be vaccinated. And that's the way it is. And if you want to go to England, you got to be on quarantine, 10 days of quarantine. And after 5 days, you can spend some money and try to get a COVID negative test. They may be able to allow you into the city. And lastly, Taj Mahal. As you know that India has been through the second wave of COVID-19, predominantly from Delta variant, and they've come out of it. And it would be suicidal for somebody unvaccinated to go visit. And I don't want to say that, but incidentally, this is a tomb of somebody that's a loved one. And so it is very, very sad if you still want to be unvaccinated and travel, that you're going to take a serious risk. So I'm going to stop over here, and I'm going to invite Carla to say a few words, because this is a great milestone in the history of Canon Hospice.
Just loving on them for the years they have given us working with our Canon family. However, I want to take this opportunity also to thank the Canon family for their love, their support as we venture off into this mission of going door to door, which is now is being recognized by the state of Louisiana as a module for us to use to get us out of the peak where we at. It's sort of like we have plateaued. So now they realize this door-to-door campaign is the vehicle. Right now, we had 1,300 vaccines being completed. Miss and I has been blessed to go to the White House, made the SAVE, the campaign that we work with under the leadership of President, our former President Barack Obama, was able to help us to come on board to go to the White House. There, we hope to connect so that we can network with different individuals in that group, tell our stories so that they see now that there is a greater need while we have this time. Let's also protect, while we're protecting the elderly, the family, we need to focus on children going back to school and colleges as well. So it's a lot of work to be done. We just need a lot of volunteers. As we come back next week, regroup, we're gonna redistribute how we go out. Our plan is to have a team that will go out and knock on the doors. Another team is gonna come and do the vaccination. Like that, we will not miss anyone at that time. Reason why I became a nurse at 7 years old, as my mother wrote in her Bible and we had a chance to read, she told the story how at 7 years old, I would take her white sheets and cut it up and go in the neighborhoods and bandage up people bobos or whatever they have. If family members were sick in our family, they would always ask my mom or dad to let their little Marie come pray for them. So nursing has been birthed into my life as a child. I did not start my career. It was my choice because I wanted to be a mother first. And I had 3 growing boys and I wanted to be part of their lives. So when they all enter high school, that's when I ventured into my career. But to me, nursing is a rewarding career. It helps us to give that love to others and care for them. And once again, I just want to thank the whole Canon team as a whole, Dr. Kula, and this whole campaign for just allowing me to be part of the Canon network. This process has helped me in some ways to cope with dealing with the death of my husband by helping others bring closure to their loved ones. So with that said, I want to go back to the little celebratory, but thanks to Dr. Kula, the whole family, to everyone, I just say thank you.